Okay, I'm going to go ahead and record.
Recording in progress.
And are we good to let the public in?
Yeah, let's go.
All right, so just give them a couple seconds to get
I just want-
acclimated. Should be good to go, Rick.
Okay, great. Okay, so welcome everyone on the board and the public to the Board of Health, and in our meeting tonight focused on the current mask mandate. I think that first on the agenda is to just review, and this is a relatively abbreviated special meeting. We'll be talking about, we'll be reviewing the minutes from a week ago and approving them hopefully, and then have a discussion around having a discussion around the town mask mandate and voting on whether to continue or rescind it. And then we'll adjourn. So it's a very focused meeting. In terms of the minutes from February 3rd that the board members received, were there any comments, edits, suggestions to them?
They're great as usual. Thank
Yeah,
you, Jackie.
Look good to me. So I'd make a motion to approve. Have a second.
Second,
Okay. Roll call, Carrie. Paula.
yes.
And Rick, yes. Okay. So in terms of the topic at hand, when we met last week, we had a long discussion around the town mask mandate and decided to reassess that. And originally decided to reassess it on the 17th. I think what's happened in the past week has been that the case numbers have continued to decline pretty dramatically. And you know, the governor's announcement, which was anticipated, came yesterday, but was anticipated even before then, you know, it raises questions around the coordination between school and town, mask mandates and so forth. And so we decided that it would be best not to wait another week, but to meet tonight and have another discussion and go from there. So, you know, we received a lot of feedback from the community, which we appreciate. And, you know, I think one of the pillars of good public health is a engaged and energetic public around the issues. And so that's really helpful for us. And we also follow the science and the data as well. So we have to put all these things together, but really appreciated the feedback from the community. I wanted to clarify a few things before we get started that came up in some of the feedback, and I think there's some general confusion about what the Board of Health can and cannot do and the scope of our authority. First and foremost, we actually are not responsible for reversing the mask mandate in schools. This mandate was decided upon by the state Department of Elementary and Secondary Education, which has legal authority to do so. And the school committee ultimately, with the mandate expiring on February 28th, has the authority to make a decision following that as to what the town's schools will be doing when that mandate expires. So although I think perhaps the school committee will take into consideration this discussion tonight from the Board of Health, we're not the deciding authority around the school mask mandate. Similarly, back in September, the trustees of the public library passed a mask mandate for the library, and they are responsible for that mandate, and not anything we do tonight doesn't necessarily impact that. We're not going to be talking about the Pleasant Street mandate tonight. I think the plan is to reassess that at our next meeting in March. We also don't have authority over daycare facilities that are licensed by EEC, the Early Education and Care Department of the state. We do have authority over non-licensed daycare facilities, and we'll talk a little bit about that, I'm sure, tonight. Finally, we also do not have authority over certain mandates from DPH and the federal government regarding mask wearing. And this includes, mask wearing for transportation, buses, trains, planes. It includes mask wearing for healthcare staff, for people in congregate care living. And I think there's probably one other area that that has been carved out. And so I want to kind of bring us back to really focus for everyone in the public and certainly for the board discussion, that we're focused on what should we do about the mask mandate that was approved on January 6th by this board, which required masks to be worn in all indoor public places. And that's the focus of our discussion tonight. What I thought we could do in terms of having this discussion is I'm going to first ask Aday and the public health nurses, if that's what the plan is, to provide us with any information or data that they see as pertinent and relevant to this discussion. And so we'll hear first from the health department staff. And then I actually have done a little bit of work and data collection, and I'd like to share that with the board, if you can humor me around that. And then we're going to turn it over to the board. We want to hear from all the board members about their thoughts on this. And then, we will have a motion. I actually have a draft motion, but there could be others. And we'll ultimately take a vote. So that's the plan for the remainder of the meeting. So with that, I'm going to turn it over to Aday and take it away.
Thank you very much, Dr. Lopez. Good evening, members of the public. So I'm just going to make this really brief. I would like to defer information about the data to the public health nurses, but I'm just going to give us a one-liner. So pretty much we're back to the levels that we were before the Omicron surge. That's where we are right now. So I mean, it's straightforward. I would like to defer to Christine and Sean to give us data points. Thank you.
Christine.
Hi, good evening. This is, hi, this is Christine Harris, one of the public health nurses. And this is a routine weekly nurses meeting that I provide. It is COVID data that is obtained through Maven reporting. and that is from the state, the Department of Public Health. And the data is subject to change. It also does not include any home COVID testing that may be performed. And I'll just go over the report as I typically do. The total case count is 4,486. Our active case list, and this is over the past 7 days again, is 42 cases. That's significantly down this week. Deaths are remain at 53. And I would just like to say that with regards to the most recent 2 deaths, that both cases were vaccinated, they were over 80, and they did have multiple comorbidities. The number of transferred cases remain at 16. Recovered cases, 4,375. At the present time, there are no known clusters. And with regards to other communicable diseases, there are no influenza cases to report this week. And there is 1 campylobacteriosis case. And that investigation is ongoing. That concludes my report.
Thank you, Christine.
Any questions at all, or Shuang, did you have anything you wanted to relate to us?
I just want to add, our, flu vaccination rate is high, and our, booster rate is around 50%. So that's it. Thank you.
Okay. Yes, Paula, you're on mute. Yep.
Christine, the numbers that you're presenting, do you have a sense if there are any cases that you that have been infected and recovered that you might not even know about?
So I would say that there are a lot of cases that, a lot of positives that are being called and reported to us, that with the home testing that's being conducted now, there's more of that. So the numbers do not reflect any of the home tests or any non-medically monitored tests.
Thank you.
It's not included in the total amount.
Great, thank you. I kind of thought that, but I thought the public would like that information as well.
Okay. Thank you, Shuang. So I'm going to move on and talk a little bit from my perspective. I've been doing a lot of thinking about this. And let me see if I can share my screen. Hold on 1 sec. Okay. Okay. So, there has been a lot of activity in this space in the last week or two, and I've been reading a lot about other boards of health and that have had active discussions, just as we have had, around the utility of their particular mandate, whether it's just a municipal mandate or a townwide mandate, not to mention the school mandates. And we've all heard in the news in the last few days about the number of towns and cities that have withdrawn those mandates. And these discussions are difficult because although there is science and there's data, there's also a lot of judgment that needs to be used. And it's not it's in a space where there are a lot of gray areas. It wasn't very gray back on January 6th when we had several hundred cases. And it certainly wouldn't be gray if we had none, but we're right sort of in the middle with some. And so we have to take a lot of things in context. And so I wanted to talk a little bit before I share my thinking around the mask mandate, just around masks themselves, because I think it sort of has to be said, and that is that masks do work. You know, you may not think, or you may not think that it should be working now, or they're not appropriate now, and that, you know, is up for discussion for tonight. But the fact that masks work to reduce the transmission of COVID and other respiratory diseases is really not terribly controversial in the scientific and public health community. This graphic, which came from a California study that was published by the CDC a few weeks ago, shows you know, the decreasing odds of transmission when various types of masks are used. And certainly cloth masks are the least effective. And so that has definitely become clear. This link that I put on the screen is a really cogent discussion of the science behind masks for COVID-19. It's on the CDC website. You can Google CDC scientific briefs, you know, masks or COVID masks, and you can pull it up. It actually summarizes 19 scientific studies showing the efficacy of the use of masks in various settings for COVID, and it's documented by 90 references. So I think that the science is clear there, that masks do work. And I wanted to make that clear because whatever we decide, you know, today, I don't think masks are going to go away, and there could be future surges, and people really need to understand the science behind it. I showed this screen, I think it was the end of December when we first started talking about the mandate, where I looked at 25 communities at the time who had a mask mandate across the state versus 18 communities that did not. And, you know, this shows the average daily incidence of COVID at the time. This is back on the end of December. And you could see that the average incidence of COVID in communities that had a mask mandate compared to those that did not have a mask mandate is lower. Sure, there's a lot of overlap there, but generally speaking, that was the fact. So that was one of the thoughts at the time to push us to have a mandate in the town. Since last week, I've done some more data collection, and this is data that is available on mass.gov and available to everyone. And what I wanted to do for my own purposes, and this is not a scientific study, it hasn't been peer reviewed, but this is looking at data. And I looked at 6 towns that have had a town mask mandate going back at least to October. And many of them instituted, several of these instituted their mask mandate in August or September. And I wanted to pick towns close to Reading, but actually when looking for towns that have had a mask mandate for that long, I had to go further afield. I then looked at 6 towns closer to Reading that don't have a mandate. Now, I considered a municipal town mandate as not having a mandate because the impact on the community of people coming into town buildings is really tiny. And so I picked these towns. This is sort of random, you know, I didn't I didn't look at the data first and then pick them. I just picked them and went with it. The numbers in parentheses are the percent of people in the community who are fully vaccinated, not necessarily boosted, but fully vaccinated. And what's interesting is that the towns that seem to have tolerated a longstanding mask mandate tend to have higher rates of vaccination than the towns that didn't. You know, it's not exact. There's Lincoln here at 60% and Linfield at 89, but in general. And as I think Shuang said, Reading's at about 75 or 76%. So I took a look at these two groups of towns, averaged their incidence of COVID going back to November 4th until today, until the data that was released today at 5 o'clock from the state, and look to see what would happen. And this is what I found, that if you start here on November 4th and you end here on February 10th, and this is sort of the late December, January timeframe, you can see that those 6 towns on average that did not have a mask mandate had a higher peak, higher numbers, 250, 275 per 100,000 of COVID, than the towns here in blue that had a mask mandate going back at least to October. And I just put in Reading in gray here, just so you can see where we stand. And for me, what this said, and again, this is not, you know, a highly technical study, but just my perusing of the data. It said that the cities and towns that had a mask mandate had a lower rate of COVID than those who didn't. And that difference was greatest when there was a lot of COVID going around. And back here in November, the differences were less profound. And that's sort of intuitive. You know, the more infection, the more virus that's going around, masks are more likely to help. When the ambient or the current prevalence of the virus in the community is lower, masks may make less of a difference. Now, obviously, this is not case controlled for vaccination status. And so I'm not sophisticated enough to do that. And that could have had a role as well. And so, you know, my interpretation is that towns with long-standing mask mandates had a lower incidence of COVID than towns that didn't. And, you know, the difference is smaller when there's a lot less activity than, and it's larger when there's a lot of COVID activity. And, you know, you might say, well, so what? You know, what does this difference mean between here and here? Or, you know, all along here, what does that difference mean? If you looked at it and you looked at the difference in rates and you multiplied it out and did the math according to the populations, those 6 towns in aggregate between November 4th and February 10th would have had an excess of about 5,500 cases of COVID, more than the towns that didn't have the mandate. In other words, if those towns that didn't have the mandate had the same rate of COVID that the mandated towns would be, they would have had roughly a lot fewer cases of COVID. About the incidence of hospitalization with COVID is about 2.5% of cases with COVID. So that this sort of calculates to about 116 hospitalizations in excess, and about 2% of people who are hospitalized die of the disease. So it'll be about 3 additional deaths. So there is a consequence here. So, you know, I think that the value of masks should not be put aside, regardless of what we decide tonight. And I wanted to, share my exploration of the data, even though, again, it's not a scientific study. So this is where I have come down on this, and we're going to hear from each board member, and then we'll go from there. It's important when you are trying to make a decision about a very complex subject that you take into account the context, then you look at the current state, and then you make a decision. And so the contexts are that masks are effective in reducing transmission, that public health interventions really need to be proportional to the public health threat. The threat was very high in late December and early January, and it warranted a strong mask mandate. But there's a proportionality. And in this case, mandates do have issues around how to enforce them, economic issues in terms of businesses, mental health impacts for some people, social impacts. And so these impacts need to be weighed against the current risk of infection. And then there's no formula for that. There's no, clear-cut this versus that. It's a judgment call, I think, at this point. There have been lots of attempts out there to create sort of sets of guidelines that are numerically based, hospitalizations, ICU, and so forth. And they may have some use, but I think ultimately one needs to make a judgment looking at the context. The current state, as Christine and had mentioned, is that the active case counts are down. And actually a case count in November 4th was 50, the active case count. Today it's 42, so it's actually slightly lower. And the positivity rate for Reading has dropped from 19% in early January to 7.8% today. Actually still a little higher than the statewide rate. And the wastewater viral RNA content, which is a good indicator of future incidences, really has continued to come down. So we have a certain context about what we understand, and we have data around where we stand today. And so from my perspective, and I think, again, this is a gray area where people can have honest disagreements, but I think, rescinding the mask mandate does make sense, but I wouldn't hesitate to advocate to reinstate it if, in fact, we saw, again, high COVID activity, and we're going to monitor that. And so, I'm convinced that masks do work, and they are helpful from my review of the data. I think that we should retain a strong mask advisory for indoor public places. Private businesses, are free to implement and enforce their own policies for their employers or customers. I think we need to strongly encourage vaccination and boosters, because I think those cities and towns that have 80% rates and 5% rates, are going to do better than 75%, than towns that have 75 or 60%. We're going to retain I would recommend retaining the Pleasant Street Center mandate, because they are the most vulnerable patients. And as you heard from Christine, it's in that age group that we've had our deaths, and we can always reassess that. Although we, in terms of the daycare facilities, where we've had a lot of clusters during the height of the surge, I think we ought to mandate, I would recommend we mandate that that they also follow the mask guidelines that were promulgated by EEC on September 7th. And these are basically, all adults in and around these daycares, whether they're teachers, janitors, food deliverers, anybody in these, that they should be masked in these facilities. and that the children between ages 2 and 5, it ought to be at the parent's discretion. And then finally, we had all those exclusions that I mentioned earlier that would not be impacted by any rescission. So that's kind of where I am at this point in terms of my thinking. And I would open it up to any of the board members for their thoughts, comments, suggestions, and kind of go from there.
I'll go.
Okay, Kevin?
First, Rick, I do appreciate you putting that information together, though, but as a board, we shouldn't be putting graphs like that out that don't take into a full account all the data sets you would need to determine what actually that numbers would look like. I have a real issue with things that go off for singular data points. As I said the last time, data is one of those things that you really need to look at from a lot of different scopes and angles in order to put a graph like that together that shows you what a real representation is. I'm not saying it would be different, but I think it's important that, moving forward, that the board only, if they're going to put forward their own information, that it really needs to be thoroughly put together with a lot of different data points to look at it. There was about 15 running through my head just as you were showing it to me that I was wondering what that would affect that graph. So not to start off with a negative, but I feel really strongly about those things. And secondly, I think everyone, all you made my point perfectly clear the last time. I agree with everyone that we should rescind it. And for all the reasons that you laid out earlier, Rick, in regards to the MWRA, the vaccination rates, certainly the percent positivity being really, really low as well. So I am all for rescinding it.
Thanks, Kevin. Any other comments? Jerry?
Yeah, so Rick, I just want to thank you. That was a great presentation. I actually think that my thoughts were fairly similar to what you were saying. And Kevin, I understand your concerns about data, which is what makes this so complicated, right? So I think we have to recognize that everyone's doing the best that they can. But I agree with Rick and I support those decisions.
Mary?
Thank you, Rick, for taking the time and effort and using your training to pull together all of that material for us. I know it was a lot of work and I appreciate the effort that you made. I do understand that data is complicated, but I think that you did a really nice job of pulling together data points and providing, as we do with the science, providing both the points and the limitations to it. We're not in the sales business. We're not in the marketing business. We are considering all of the pluses and minuses and coming to a decision, just like you said, considering all of the context. And I appreciate your leadership in providing that information. I think that I want to highlight one thing that you pointed out in that first graphic that you had with the masks. And you pointed out that cloth masks were the least effective, but that least effectiveness rate was still 56%. And that's not insignificant. So I want to make sure that is pointed out, that yes, surgical masks, N95 masks, KN94s, KL94s are all have higher degrees of effectiveness, but cloth masks still do provide some measure of protection. And it's not an insignificant measure. So like Jerry, my thinking was similar to yours. I've done a great deal of thinking about this, been looking at all of the different data points, and I concur with the recommendations that the positions that you put forth on how you were thinking about this. I think that with the continued monitoring of activity, with the protections in place for our senior citizen population, our unvaccinated children aged 2 to 5 that might be in childcare, things like that. I think those are particularly important protections. And I think that, yes, we could rescind and put forth a strong recommendation that folks continue to mask.
Thank you. Thank you. Paula?
Messed up.
Mm.
Thank you. Also, I thank you also, Rick, for the work, the effort you put into that, and as well as for your leadership through all this. Again, like the other members, many of my thoughts were similar. And I wanted to thank the public as well, because I read every one of the emails and phone messages, or heard the phone messages, and I very much appreciate the input. There were several people who were encouraging us to continue the mask mandate, and with good reason based on the data that they have. But with all of that information, my thoughts are more concerned about mental health. I think we're at a point where we really have to balance the risk benefit of the masks versus COVID and the mental health issues. I think we are at a point where the masks have served their purpose, and that the mental health is the current pandemic. As we've heard, even as we heard Kevin's report on the coalition last week, how rampant the mental health, how stretched the mental health services have become. So in light of all of that, I too vote to rescind the mask mandate.
Well, I appreciate all your thoughts, and I know that this has been, a difficult decision, and I think, I would also say, in terms of, I just want to mention the public. A lot of the comments we received had to do with the school mask mandate, and we did forward those all to the school committee, so they read or either heard the voicemail or read the emails that you sent if they were related to the school mask mandate. I think that we may want to consider in the future, although I haven't, maybe we can have a discussion at the next board meeting, whether we want to create some kind of, in advance, some kind of decision matrix that says when, X, Y, Z are at these levels, we should strongly consider a mask mandate versus strongly recommend, so that we have, in a more proactive and preventative way, we have some kind of matrix or framework to make these decisions, as opposed to kind of, living in the presence. So I just throw that out there. So I took the January 6th mask mandate that was, fairly formal, and I edited it with, my comments, sort of using my comments as the basis for it. And what I wanted to do now would be to read through this together, make any changes that we think should happen, and then we can take a formal vote on it. Okay, let's see, share screen, where are we? Here. Okay, so, you'll recognize pieces here from the January 6th mandate. So notice is given that on February 10th, the Board of Health adopted the following emergency order under the appropriate provisions. And based on our review of the caseload and the testing positivity rates, we held a meeting today and voted to rescind the public health mask previously authorized on January 6th. The following provisions to this new rescinding order apply. So these would be the new provisions. That, effective tomorrow, face coverings are no longer required, but is strongly recommended for all individuals older than 2 years of age in indoor public places, houses of worship, public meetings, and so forth, except where the individual is unable to wear face covering due to a medical condition or disability. So that's the exact same phrasing of our previous, except I I said no longer required, but strongly recommended. And I kept in the, this piece around the N95, KN95 and surgical masks being, strongly recommended. Secondly, I thought putting something in about vaccination, making a formal statement about this was important. I mean, we've always felt that, but we actually didn't state it in the original order, and we actually have never taken a formal vote on this. So, we really recommend all eligible residents have their vaccination as well as their boosters. And this is the most important thing that everyone can do. And we're at 75%, but only 50% on boosters. And, we could do a lot better, and there are a lot of other communities that have. I kept the public meeting piece in here and would leave that up to the chair of each of those commissions, boards, and committees. The state emergency guidelines around public meetings are scheduled to expire April 20th. And so we'll have to see come April, what the state mandates in terms of the open meeting law. As we said, we'll continue the Pleasant Street mask mandate. And then, as we also stated, there are a whole bunch of situations where the state and the federal government have mandated masks, and that is not changed. Obviously, that is not, we don't have the authority to change that. In number 6, as I mentioned, we would exclude entities that are licensed, daycare facilities that are licensed by EEC. They have to follow the EEC guidance, which is adult masking, children masking at the recommendation of parents. But I would say that we ought to mandate that non-licensed daycare facilities in the town of Reading follow those same guidelines that were actually promulgated on September 7th, and you can go to the EEC website and find them. Until EEC either rescinds them or revises them. As we talked about, it excludes the public schools, and it also excludes the Reading Public Library. And then I didn't change this wording here around the enforcement, which at this point, the enforcement is really around the Pleasant Street Center and the non-licensed daycare centers. And then, we'll review this. We're going to continue to look at the data. And so here, this would be 3-0, but we'll take a formal vote. So I would like to make a motion, unless there are any edits that people would like to this.
Rick,
yes, Kevin.
I just have a couple things just reading through this. So paragraph 6 is kind of muddy to me, and maybe it's just me. So if it is, let me know. But midway down, the order excludes Reading Public School. Excludes Reading Public Schools, which are required to follow guidance from DESE. However, Reading Public School buildings, facilities, when used for non-school related activities, are subject to this order.
Actually,
this order doesn't have any
right, exactly. That's a good point.
Okay, I just want to,
yeah,
it might be me for a second. It was just reading kind of funny. So,
yep.
Is that to mean that even for non-related activities, you still have to follow the Reading Public Schools guidance in their buildings, which is to right now currently to have masks?
When this is wording from the original January 6th order, and what this meant was that if a group decided to use a school facility some night for a totally unrelated, non-school related thing, they would be subject to the indoor mask mandate. But given that we are not mandating, but strongly advising, that phrasing, yes, I would agree, should come out.
Okay. So maybe it just needs to read rather than are subject to this order as a subject to school committee policy.
Right. And so why don't, not exactly sure how the best way to do this, because I can't edit actually when I'm sharing the screen. But let's say that that we would take out this phrase here. However, Reading Public School buildings, when used for non-school related activities, are subject to this order, which doesn't make sense if it's not a mandate.
Right.
So we
Yeah,
would
just strike the whole
strike that.
sentence. Yeah. Okay. I'm fine with that.
Yeah.
And then the other one was that just, again, it just reads kind of muddy to me on paragraph 1 here. Open to the public, except where an individual is unable to wear a face covering. We're rescinding the face covering, so there is no unable to wear a face covering need, right?
That's, yeah. Boy, do you have a law degree? Are you pick these things up?
Devil's in the details, as they say.
Yes. Okay,
so
that is correct.
All right, so
We should remove that. So we should remove that, probably put a
period at public meetings and then remove the rest.
public meetings or private spaces open to the public, period. And then take out the exception because it isn't an exception because we're not being,
Yeah, and then remove it all the way to disability and then keep the
Correct.
rest after that. And then one thing I would consider, being how we really have had a lot of strong input from the public, is I would make this effective immediately. I would make this, what time is it? Let me get a clock. I would make this effective at 8:20 p.m. on the 10th.
I have a question about that. I know that there was a problem with being able to implement. Can we rescind immediately? Because I know we couldn't put things into effect immediately. So does it work both ways the same, or are there differences because of different application?
I would think there is differences. I think if you're going to make somebody effectively monitor people, they really would need a heads up. If they don't need to monitor them, I don't know why they would need a heads up.
Oh, I would think they would. But sure, that's fine.
Yeah, I mean, 12:01, 8 o'clock, it's 4 hours. I don't see any difference there.
how do other people feel about that? I don't feel strongly one way or the other. I don't think a lot's going to happen in the next, 4 hours, but, it'd be worth talking about.
I have no strong opinion.
I was just curious about with Kevin as our parliamentarian, knowing how things were, can't put, what our timing needs to be for putting things in place or taking things out. I know that he knows how those things work. So that was my question.
Yeah, Carrie, I mean, it's a valid point. And maybe I'm going on the side on this one where, just because we've had so much input, maybe it's a nice show by the board to just say, as of right now. And if I don't know if we're going to run into problems between now and close of business tonight with folks. And that's to say, all you folks that are on the line right now, don't just start running out the businesses just because you can and start telling them you don't have to wear a mask. Please do me a favor, will you? I'd appreciate it.
Yeah, I mean, I think actually that's a really good point, Kevin. I think it's important because I have heard instances of people giving staff at businesses a hard time when staff have been approaching them and saying, there's a mask requirement. So I think that's a really good point. Thank you.
And that's all I have.
Hey, Dr. Lopez, I just have a quick question on number 4. Is that going to be 2021 instead of 2022?
Oh, yes, that's right. Good pickup. I think what I'm going to do is I'm going to stop unless there are other comments. I can't edit this while I'm sharing, but if you give me 60 seconds, I will make those changes and put it up for a vote. Yeah. All right.
Day, you look so happy.
I think he's glad the day is over.
I am. I'm extremely happy.
Thank you for fielding all of the feedback that I know you have been receiving. And I know not just you, but other folks in fielding the phone calls, reviewing the forums and the like, thank you. And thank you for forwarding everything so timely so that we could have a, bird's eye view of what was happening for you all. It's important to see.
Thank you very much. And I would also like to thank the health department staff, Christine, Sean, and Jackie is not part of the health department staff, but she is one of our, one of the staff, because she's always there for us. So, I really want to thank everybody. Kim, Don, they've done a great job. I really appreciate everything they do for us. So thank you very much. I want to thank the board as well for, looking at the data and making the right decision for the town of Reading.
Okay, so made it effective immediately here. We took out the piece of medical disability, not wearing face masks, changed this to 2021. And down here, I took out the piece about using the school facilities. So I think those were all the pieces of comments. So with that, I'd like to make a motion for approving this emergency order as written. Do I have a second?
Second?
Okay. Roll call, Carrie,
Yes.
Paula,
Yes.
Rick, yes. And we'll change this to 3-0 over here. And that is it, I think, for tonight. I think this was a good meeting. I know that all the board members have really spent a lot of time in the past week really thinking about this and looking at the data. And I think we came up with a good balanced decision. I think it was difficult, but it's clear this is the right way to go. We'll continue to monitor the data and make other decisions in the future. So if there aren't any other comments, appreciate your service, and I make a motion to adjourn. Second? Anyone?
Second.
Okay, Carrie. Roll call, Paula.
Yes.
Carrie.
Yes.
Rick, yes. Okay, good night, everyone. I'll see you on March 3rd.
Everybody.
Good night, everybody.
Thank you, everyone.
Thank
Thank
you.
you. Bye-bye.